Okay, so today what we're going to do is we're going to test for the TFL. So what I'm going to do is I'm going to have pull the patient's leg out, internally rotate, and I have to resist. And it was weak. So what that's going to tell us is we need to come up here and check for internal and external rotation of the leg. So I'm going to come here, do some internal rotation, come up, P to A, spring it. Okay. Go down, do some external. Okay, we'll spring there, so we're going to do an adjustment on it. Alright, and now what we're going to do is we're going to start off with the wrist extension technique. First, let me show you what's going to happen. Go ahead and take it out. Thumb protection. Okay, so what we're going to do is we're going to do this for the knee, the shoulder, and the hip. So for the knee, what we're going to do is we're going to put 50 to 60 pounds of pressure, making sure that all of our pressure is going on for the thumb and not for the rest of the hand. With this hand, we're going to come down and meet it like this, put our leg up against it, and with 10 to 15 pounds of pressure with our fast hand, and we're going to, just like that. It's going to be the exact same for the hip and the shoulder, except we're only putting 10 to 15 for each hand. Let's go ahead and start with our patient's knee. Sir, do you mind putting your knees back? Okay. So what we're going to do is we're going to take it out. And what we're going to do is we're going to make sure to put patient's knee into full extension, going a valgus, which is going out, which would be our lateral condyle, and a varus, which would be our medial condyle. We're looking for that spongy. Well, we have spongy going in a varus motion, so what we're going to do is we're going to end up contacting the medial condyle of the tibia. So if you mind going face down for me. Alright, so what we're going to do is just move the patient's leg over a little bit so we can move our leg up here. We're going to find that tibia, 50 to 60 pounds of pressure. We're going to come in and meet it with our hand, and then 10 to 15 with the fast hand, and 8. Just like so. Sir, you mind going face up for me? We're going to go ahead and do the retest. Okay, put it back into extension, about 10 to 15 pounds, and then retest it. Oh, there. No movement. Okay. Now what we're going to do is we're going to do it for the hip. So, go ahead and get that again. We're going to go ahead and find the greater trochanter of the femur. Go ahead and make sure to move it. And what we're going to do is we're going to go halfway up and halfway back down. That's what we're going to be contacting. So I come here. And about 10 to 15 with the pressure, and about 10 to 15 with the fast hand. We're going to come in just like that. Okay, and now what we're going to do is we're going to check for an anterior humerus. So we're going to come over to the top of our patient. Sir, if you mind holding your hand straight up in the air for me. Now what we're going to do is we're going to push down, resist for me. Oh, it's pretty weak. So what we're going to do is we're going to go to that mid double pectoral groove, which is about right there. So you mind scooting over that way a little bit for me? There we go. We need to make sure to have enough room to put our leg up. Down another 10 to 15, about the exact same for the hip. This is more tender region. So what we're going to do is come right down here, and then a quick, okay. And sir, bring your arm back up again. We're going to go ahead and retest the deltoid. Okay, and resist. Awesome, strong. And that is the wrist extension technique from Shrek.